Ever wonder how the medications used to treat conditions like schizophrenia actually work inside our brains? It's a fascinating story that revolves around a chemical messenger called dopamine. Today, we're diving deep into the world of dopamine pathways, antipsychotic drugs, and a set of side effects known as EPS. Let's get started. So, what exactly is dopamine? Think of it as the brain's multi-talented superstar. It's a neurotransmitter, which means it helps nerve cells communicate with each other. Dopamine is famous for its role in making us feel pleasure and motivation. That feeling you get when you achieve a goal or eat your favorite food. That's dopamine at work. But its job is much bigger than just rewards. It's also crucial for controlling movement, regulating mood, and even our ability to focus and learn. To do all these different jobs, dopamine operates through specific routes in the brain called pathways. Imagine these pathways as highways, each leading to a different part of the brain and having a distinct function. There's 4 major dopamine highways we need to know about. First up is the Mesolimbic pathway. This is often called the reward pathway. It connects an area deep in the brain called the ventral tegmental area, or VTA, to another area called the nucleus accumbens. When you experience something rewarding, dopamine flows along this highway, making you feel good and motivating you to do that thing again. Now, in conditions like schizophrenia, it's thought that this pathway becomes overactive. Too much dopamine activity here is linked to the positive symptoms of psychosis, like hallucinations and delusions. It's like the volume on this reward signal is turned up way too high, causing the brain to misinterpret reality. Next, we have the mesocortical pathway. This one also starts in the VTA, but travels to the prefrontal cortex, the part of our brain right behind our forehead that handles complex thinking, planning, and decision-making. This pathway is all about cognition and executive function. In schizophrenia, it's believed this pathway is underactive. Not enough dopamine activity here can lead to the negative symptoms, such as apathy, social withdrawal, and a flat emotional expression. Think of a D2 receptor as a parking spot for dopamine. Antipsychotics essentially park in these spots, blocking dopamine from landing and sending its signal. By blocking dopamine in the overactive mesolimbic pathway, they successfully reduce hallucinations and delusions. Problem solved, right? Well, not exactly. Here's the catch. These medications aren't very selective. They don't just block dopamine receptors in the mesolimbic pathway. They block them all over the brain. They're like a citywide parking ban. And this is where the side effects come from. Remember the Nigrostriatal pathway, the one that controls movement? When antipsychotics block dopamine receptors there, they create a state of low dopamine activity, similar to what happens in Parkinson's disease. This disruption leads to a group of movement-related side effects called extrapyramidal symptoms, or EPS. The name comes from the extrapyramidal system in the brain, which helps regulate motor control. Let's break down the main types of EPS. First, there's acute dystonia. This usually happens within hours or days of starting the medication. It involves sudden, involuntary muscle contractions, often in the neck, jaw, or eyes. 2. It can be quite frightening and uncomfortable, causing the head to twist to one side or the eyes to roll upwards. Then we have akathisia. This is a state of intense inner restlessness. People with akathisia feel a constant, compelling need to be in motion. They might pace back and forth, shift their weight from foot to foot, or be unable to sit still. It's not just physical. It's a deeply distressing mental sensation of being unable to find a comfortable position. Next is parkinsonism. As the name suggests, the symptoms mimic those of Parkinson's disease. This includes a tremor, especially when at rest, muscle rigidity or stiffness, and bradykinesia, which is a slowness of movement. You might notice a shuffling walk or a lack of facial expression, sometimes called a masked face. These 3D and Parkinsonism are considered early-onset EPs because they tend to appear relatively soon after treatment begins. But there's also a late-onset form of EPs called tardive dyskinesia, or TD. Tardive means delayed, and this condition typically develops after months or even years of taking antipsychotic medication. TD is characterized by involuntary, repetitive movements, most often involving the mouth, tongue, and face. This can look like lip smacking, chewing motions, or frequent blinking. In some cases, it can also affect the limbs and torso. The most concerning thing about TD is that it can be irreversible, even after stopping the medication. What about our other pathways? When antipsychotics block dopamine in the Tuberoinfundibular pathway, they take the brakes off prolactin production. This can lead to high levels of prolactin in the blood, a condition called This can cause issues like breast enlargement, milk production in both men and women, and menstrual irregularities. And in the mesocortical pathway, where dopamine activity might already be low, blocking it further can sometimes worsen negative symptoms like apathy and cognitive difficulties. This is why newer medications, known as second-generation or atypical antipsychotics, were developed. These drugs are a bit more sophisticated. They still block D2 receptors, but they tend to bind to them more loosely and dissociate more quickly. More importantly, many of them also affect other neurotransmitter systems, especially serotonin. This dual action is thought to help them be effective for positive symptoms while having a lower risk of causing those severe motor side effects. EPS. They might even have some benefits for the negative symptoms. However, lower risk doesn't mean no risk, and they come with their own set of potential side effects, often related to metabolism, like weight gain and an increased risk of diabetes. It's a delicate balancing act. The goal of treatment is to calm the overactive mesolimbic pathway without causing too much disruption elsewhere. Doctors have to carefully weigh the benefits of reducing psychosis against the risks of these side effects. Managing EPS is a huge part of treatment. This can involve lowering the dose of the antipsychotic, switching to a different medication with a lower EPS risk, or adding another medication specifically to counteract the motor symptoms. 2. It's incredibly important for anyone taking these medications, and their families, to be aware of these potential side effects. Noticing the early signs of something like akathisia or dystonia and telling your doctor right away can make a huge difference. Never stop or change your medication on your own. Always work with your healthcare provider. If you or someone you know is struggling, please know that help is available. There are resources and support systems that can guide you. We'll leave some links in the description below. Understanding these dopamine pathways gives us a much clearer picture of how these powerful medications work and why they can have such a wide range of effects. It's a testament to the incredible complexity of the human brain. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more deep dives into the science of our minds. See you next time.